40-year-old male presents with itchy rash on his chest. Physical exam reveals an annular and scaling plaque with central clearing on the chest is shown. KOH preparation of skin scraping shows branching septate hyphae and topical application of terbinafine was prescribed. Which of the following mechanisms of action explains the antifungal activity of this drug? So this question is going to be asking the mechanism of terbinafine. A quick mnemonic that I use to remember the mechanism of action of terbinafine is so terbinafine works by inhibiting squalene epoxidase, and terbinafine kind of sounds like a turban. And as you can see from this picture, a turban squats on the head. So you can use this as a mnemonic to remember that turban squatting on the head should remind you of terbinafine's mechanism of action, which is to inhibit squalene epoxidase. Now, squalene epoxidase is ultimately going to inhibit the conversion of squalene to squalene epoxide, which ultimately gets converted to lanosterol. And so lanosterol normally gets converted to ergosterol, and ergosterol is going to be an important component of the cell membrane for fungi. So this is how terbinafine is going to work, is by basically limiting the production of ergosterol, which is going to be an important cell membrane component. Now, in the image that the question has shown us, we had tinea corpus, and here I have a picture of the Marine Corps logo. So as you can see, there's this red thing outside, and then there's this central clearing. So this is how I like to remember the presentation for tinea corpus. We get this erythematous ring, so I'm going to be just outlining the erythematous ring. So here is the erythematous ring. And so we have this erythematous ring, and in the center we have this clearing. So there's this white stuff and then there's this red stuff. So it's kind of like the logo for the Marine Corps, and it sounds like tinea corpus. So the answer to the question is going to be answer choice B. Terbinafine is going to work by inhibiting squalene epoxidase. Answer choice A is binding to ergosterol. The drugs that are going to do this is going to be nystatin as well as amphotericin B. So they bind to ergosterol, which is going to be a cell membrane component for fungi. And so once those drugs bind to ergosterol, they basically create pores in the cell membrane that leads to cell lysis. So this is going to be the mechanism of action for amphotericin B and nystatin. Answer choice C, blocking beta-D-glucan synthesis. Beta-D-glucan is going to be an important cell wall component in fungi, and so the drug class that is going to do that is going to be the echinocandins. So they work by blocking beta-D-glucan synthesis. Answer choice D, preventing mitosis by binding tubulin. This is going to be the mechanism of action for Gracia fulvin. Gracia fulvin is going to bind to the microtubules, and so by doing that, it's going to inhibit the progression of mitosis. Answer choice A, inhibition of fungal protein synthesis. This is going to be the mechanism of action of flucytosine. Flucytosine is basically going to inhibit the production of nucleic acids, and so we ultimately do not get fungal protein synthesis. So the answer is going to be B. Terbinafine is going to work by inhibiting squalene epoxidase, and you can use the mnemonic that I use to quickly recall this.